Hello, my name is Cheol Kim. I'm a licensed acupuncturist. Today we're going to have a subject for rheumatoid arthritis. And a lot of people nowadays they have suffering this kind of a symptom. So they are hoping for, is there any way to have a good way to treat those kind of symptom? Yes, we're going to discuss how we can get better by the acupuncture with the herbal medicine. And before that, I'm going to explanation about the rheumatoid arthritis. And then this is a Western medicine way we say autoimmune disease. So our antibody try to attack our own cell. So they are taking some kind of cell from the knee or some joint or the finger, and then later, if not really been treated, it causing a lot of deformities. So the finger getting really terrible ways of deformities. So as I know, the Western way, they have some kind of pill for the relieve the pain, along with the steroid kind of treatment. But the Oriental way, we have a great herbs to reduce the symptom. We also reducing the for the postponing for getting more or worsening for whatever like that. Okay, so rheumatoid arthritis is one of the a lot of people suffering, and they are really have some hoping for the some alternative way of treating. So today I'm going to explanation by the Oriental way. This is the Chinese letter, but I'll explanation by the English. The pung is the wind, okay? Wind harness the cold. And sip is the damp. Okay, what does it mean? The windy, cold, and dampness, and that kind of environment. People who live this kind of weather or some kind of exposed this kind of condition, and then it's damaging for our bones. So definitely it is one of the reasons to cause rheumatoid arthritis. The Oriental medicine, we don't really follow or chasing the name of a disease. Of course, we see the rheumatoid arthritis, but we always make what is the causing for, what is the problem for. It's different. The Western way, they say try to find out virus or bacteria and fungus or any other reason. They try to find out, but the way we do is more like try to find the natural way, what is the really problem. So people have a windy, cold, dampness, they make a stagnation. So we have the herbs to get rid of windy, cold, and dampness. We have many herbs, and then good for the get rid of coldness. For example, and this is one of the geji or yukke or dokar. There are many kind of herbs to make our body warm. So our body have a balanced, the good way, whatever the temperature. Then our body immune system or whatever try to fighting back for the symptom that is causing severe to our or sometimes harming to our body. So that's the way we treating. So then the first one we say about the wind, cold, dampness, stagnation. We have the herbs to make a warm and get rid of dampness, get rid of wind. Then it has a really good effecting to treat for the rheumatoid arthritis. Second thing is this is the wind, okay? And this is the dampness. This is the heat. Of course, stagnation. What does it mean for this? People expose too much, windy or dampness, sticky kind of environmental, or a lot of heat. If you have too much like this condition, if you live like that, also damaging to human beings, bone. So this is one of the reasons to cause the rheumatoid arthritis. So we also try to cool down for the heat, and then the cool down for the dampness wind. There is a lot of ways of the herbs like that, but sometimes we put a This is the only example. This is the name of the herbs, but this is cooling down. So then people have a lot of heat, a lot of dampness hit the knee area. Oh, I have a lot of pain. When they drink with the combination of the herbs, definitely have a good benefit. Okay. And another reason we segregate dampness. This is a dampness also, dampness. But this is a more sticky dampness. This is a stagnation, and this is a dampness, stagnation. That is make a really bad influence to the rheumatoid arthritis, which means people have purple color the lips, and then the body has gain weight and overweight, and when we see the pulse too much sticky like this. So this kind of condition we say about people have cholesterol, triglyceride, and that's slightly high, and the blood circulation is kind of poor. So in this case, we're using some kind of a good circulation, and we have the good circulation kind of drug we're using, but by naturally, it really a good way help for the rheumatoid arthritis. Another thing is kidney deficiency. Okay, kidney Cheol. Cheol means deficiency. Weak and cold is combined. What does it mean? Means when people have a kidney function weak, bone is getting weaker and weaker. And then when they also exposed to the cold weather, all the body doesn't have a good function. So we have the very warm kind of herbal medicine to make a good balance. Then ultimately rheumatoid arthritis will be really having good benefit. And then another thing is liver, kidney, in deficiency, in Cheol. Cheol means like deficiency. Okay. Liver, kidney in deficiency. People have a thirsty, and face color was a little red, and then the they feel like tiredness, and then especially they feel like thirsty. A lot of time diabetes, even blood pressure patient, I mean, we can see that. But when we have this kind of symptom, we have a good herbs like Sengji, those kind of herbs we're using to tonify for the yin, then it is really good affecting rheumatoid arthritis. And another thing is qi and blood both deficiency. Qi means energy, and blood both deficiency. What does it mean? People don't have a good energy. They feel like out of breath and fatigue, tiredness, some kind of heaviness, and then blood deficiency. People have a lot of cramping the leg, and then some kind of anemia, and they have a pale kind of looks. Those are all things like that. So we have also using for the 보증이 기탕, and we have some. This one we put a very famous fungi, and there are a lot of things put in there. But we bring up the qi, then automatically rheumatoid arthritis getting better. So this is just an example I wrote down how we treating the Oriental way. Oriental medicine, we always care about the balance. Okay, for example. This is a good balance, for example. We don't want too much excess, no. We don't want to yang too much excess, no. We don't want too little for the yin, too yang little for the like this. We don't want it. So what we wanted is a very good way of the line, the balance. So people have a yin deficiency, they have a thirsty, have some kind of fatigue, tiredness. They complain about that. The yang deficiency, they feel like a coldness. Their limbs, the hand, feet, they all feel like cold. We don't like that. When we have a poor balance like this, they always provide bad influence to our human body health condition. So ultimately it's no good. So that the rheumatoid arthritis, don't even consider the subject rheumatoid or very unknown disease, like Parkinson, ALS, whatever. We don't try to chase the name of the disease. We always consider what balance. So that ultimately, body by themselves try to heal for that. Body by themselves try to, have a good influence to our human body. So you see that, and then when you have a good balance, you have a good result. So if you have a symptom like a rheumatoid arthritis or all kind of terrible kind of a name of this, don't worry. Just come in and to our clinic to have a check by the pulse diagnosis. When you check that, you don't have to tell me you have a rheumatoid. You don't have to tell you have a diabetes, you have a blood pressure. You don't have to tell me. You go to the Western doctor, always the Western doctor ask you, why you come here? And write down every condition. What is your history you have, your parents? We don't like that. Of course, we do later, we checking for that. But before you tell me what you have a problem, I check, I tell you what you have a problem. That means we make a good balance the way we treating and good way of, try to make the organ status. So ultimately, your body get healed very naturally. The natural is the really good way of treating because of people have a good influence like by naturally any kind of disease, any kind of symptom will be automatically will be get better. I don't say I can cure, but we definitely maintain control. We get the symptom get better. Okay, so if you have a RA suffering like this, or your anybody, your friend, your relatives are suffering like this condition, just call us, our clinic, and I'll gladly help for that, gladly consultation, and what type of a problem you have. So we don't really follow or chase for the symptomatic treatment like a Western medicine they do like that. But the way we do is that we always see the body type. Why you have a coldness? Why you have a heat? Why you have a too much dampness? Why is you have a blood circulation poor? Why kidney deficiency causing the like a coldness, having really trouble or bad influence to the rheumatoid arthritis? Why liver kidney insufficiency, chi blood, why deficiency you have it there? Okay, so we have the good herbs too like that. We also recommend to have a good diet, also very important. People, when they sick nowadays, living in the modern society, when they sick, they go to doctor. That's okay, but what they do, the doctor, they always try to fix for the whatever disease by the drug. The drug is okay, but drug always follow the symptomatic treatment. I want you to more naturally, no damaging for your organ, no side effect for that, and we also highly recommend what you have to be taking the daily diet, and then with this condition. Well, everything is different, so you have to think about it. Today we have a subject, rheumatoid arthritis. If you have any question, you can call us, and then I greatly help for that. And then you have after consultation, you have a great feeling, so that we always help out for the by naturally. We, from the A to G, we always consider natural. So natural way of a balance is I believe that's the really good way. And then even sluggish, even slow treatment, and for the whatever symptom, but ultimately your body try to build strengthen about your organ, strengthen about the good balance, so that you will be very happy living long life without having difficult kind of illness. Thank you for today for the subject rheumatoid arthritis. Have a wonderful day, and thank you so much.
I had high blood pressure and cholesterol, and I had taken Western medicine more than 10 years. And because I had a side effect of that, so I go to Dr. Kim, and after 1 year take medicine with him, my high blood pressure go down below 130, and my cholesterol below 180. And my Western doctor told me I don't have to take the cholesterol, but I can take the high blood pressure medicine, 20 milligram, to protect my heart in case any case I don't have a heart attack. So that's what I take, both 20 milligram high blood pressure medicine and Dr. Kim medicine.
And also you had a problem for glaucoma. Could you tell me?
I had a glaucoma, and I see the doctor, and he treat me more than 2 years, and still my high blood pressure of my eye is still high. The pressure of the eye high at some point that the doctor tell me that I have to have a surgery. I go to see Dr. Kim after treatment couple time, 3 times, and my stabilize my eye pressure now go down below 13. I don't have to have a surgery anymore.
So you are very happy.
Yeah,
And
I'm very happy with treatment.
so now, as a Vietnam, could you tell the Vietnam people for your experience for the Vietnam language?
Okay, tôi có high blood pressure và cholesterol rất là cao, more than 200 on cholesterol, and more than 140 for the high blood pressure. After treatment với Dr. Kim 1 year, my cholesterol go down below 200, and my Western doctor tell me I don't have to take cholesterol anymore, and my high blood pressure below 130.
Vietnam language is better for the Vietnam people.
Áp suất của tôi bây giờ dưới 130, tôi không cần phải uống thuốc về áp suất nữa. chỉ cần uống với cái đô rất là thấp để bảo vệ heart attack, đó là 20 mg thôi. Và bây giờ tôi vẫn lấy thuốc của Dr. Kim, không cần lấy thuốc của Western medicine nữa. Được, cảm ơn.
So did you tell the glaucoma too?
Oh, I have my
Tiếng Việt.
The Vietnam language.
Tôi bị bệnh mắt, áp suất cao ở mắt. Đi bác sĩ Mỹ 2 năm 3 năm nay nó không hết, nó tiếp tục cao từ 13 lên đến 20. Và bác sĩ Mỹ nói tôi là có thể tôi phải đi mổ, nhưng mà sau khi đi khám bác sĩ với Dr. Kim thì nó xuống còn 13, thành thử ra nó không tung.
Yeah, I've been having to be treated by a Western medicine doctor to take care of my high cholesterol problems and my high blood pressure problem. And I heard Dr. Kim that he's a very good doctor in what you call Eastern medicine and have very high level of understanding of human function of all organs. So I came to him. He explained to me how to treat with Eastern medicine to take care of the cause of the problem rather than the symptom of the problem. And he just by touching my wrist, and he can determine my problem. And he explained to me how he's going to treat that, and that helped a lot. I understand that I get the right doctor, and after 2 months of treatment from Dr. Kim, I feel very, very good. And for now, I don't take the Western medicine anymore.
So you're taking a 2 pill for the blood pressure pill. Now we don't take any Western medication. Today showing a 135, 92.
Yeah, that's
So
good.
this is amazing, isn't it?
Yeah.
Yeah. So I'm really happy for that, and you happy for that. By the way, for the Azure Vietnam, could you tell the Vietnam language for the very much about the situation for that? Okay, a little bit louder for the language.
Tôi có bệnh cao huyết áp và bệnh nhiều có máu, có trong mỡ, có trong máu có mỡ. Thành ra tôi nghĩ là nhiều người nói với tôi là nếu mà tiếp tục dùng thuốc của Western medicine thì sẽ có những cái side effect, chẳng hạn như sẽ bị ảnh hưởng tới gan. Thành ra tôi mới lên gặp bác sĩ Kim để họ nhờ bác sĩ trị liệu. Thì tôi rất là ngạc nhiên khi bác sĩ không cần phải thử máu, không cần phải thử thuốc tiểu, mà bác sĩ có thể nhận ra tôi bị bệnh high cholesterol. Và bác sĩ bảo để bác sĩ trị cho tôi. Thì sau khi uống thuốc và chăm cứu bác sĩ Kim một thời gian thì tôi khoảng 2 tháng thì tôi cảm thấy những cái triệu chứng mà hồi xưa tôi hay bị nhức đầu hoặc là đau ngực không còn nữa. Và bây giờ tôi ngưng hẳn thuốc của Western medicine để lấy hoàn toàn tin tưởng vào bác sĩ Kim để trị liệu cho tôi, không còn bị cái chứng cao mỡ máu nữa.
Yeah, for the blood pressure, first I got a stroke, so I've been coma like 9 days. The 10 I wake up, and then I see you advertise on the TV, so I came here. I took your medication and acupuncture. I see the blood pressure come down to 120 over 60 something. So that's why I stay here with the doctor. And from that time until now, he always keep my blood pressure the same. So that's why I follow with you.
So you don't take the Western medicine, blood pressure showing up almost 115, 120.
Yeah, no.
Okay. Could you tell the Vietnam language what you have in?
Tôi bị cái tai biến mạch máu não. Tôi bị coma 9 ngày. Tới ngày thứ 10 tôi mới wake up. Bác sĩ cho tôi mỗi ngày uống 2 viên thuốc. Tôi gặp Dr. Kim, tôi trên TV, tôi đến đây tôi uống thuốc của ổng với Acupuncture, thì ổng giữ cho cái blood pressure của tôi 120 mấy trên 6 mấy, very good. Thành ra tôi keep go on with Dr. Kim.
Okay, so currently, and you have a lot of back pain, is really severe. Could you tell me what happened?
Yes, and a long time it happened to the kidney on the left, and Dr. Kim có cho tôi thuốc tôi uống một ngày sau thì nó bớt dần và tôi đi tiểu ra cái whatever in my kidney. So from there until now it's getting better.
So the doctor say you had a CAT scan, but even that, they didn't give any medication. But since you took my medication, you was really good. So could you tell me some situation, even Vietnam language?
Yes. I went to the doctor and they gave me an appointment until the 20th of May, and they told me go take the CAT scan. I go take the CAT scan, and they give me another appointment on June 1st. And from that time until now, I haven't taken any medication from doctor, but I took the medication. I get better after a day, and from there on, I keep going every day. So now I got like almost like no more pain. So I don't know. So we wait to get the CAT scan. I give it to you, so you check for me what's going on with my
And
kidney.
could you tell me about Vietnam language? Your back pain, severe back pain was better after took my herbs. Could you tell the Vietnam
Yes,
language?
tôi bị cái ảnh hưởng bên thận bên tay trái, thì tôi nói bác sĩ Kim cho tôi thuốc uống một ngày sau thì hết. Từ đó tới giờ tôi tiếp tục uống cái thuốc đó, trong khi tôi đi bác sĩ thường thì họ cho tôi appointment để chụp CAT scan cho tới ngày 1 tháng 6 thì mới appointment trở lại.
Okay, thank you.
Okay.